Before we move on, I want to quickly share something that could really help you. You can now join our online NCLEX crash course, specially designed to help you pass the NCLEX on your very first try. This program has already helped over 1 lakh nursing students clear the exam successfully. And now, it's your turn. And here's the exciting part. We're giving a limited time 70% discount on the course fee. But remember, this offer is only for a short period, and seats are filling up fast, so don't wait too long. To enroll, just download our mobile app. You'll find the link in the description box below, or you can scan the QR code you see on your screen. This NCLEX crash course is truly a one-stop solution. It's a proven shortcut that helps you study smart and pass with confidence. So don't wait. Enroll now and stay ahead of thousands of other students in the race to pass the NCLEX. And yes, if you'd like some free PDF notes for NCLEX questions and a free NCLEX ebook, just download the mobile app. You'll get instant access to all those materials right away. All right, let's get back to learning. Here comes the next question. Hello, future nurses, and welcome back to NCLEX. If you are preparing for the NCLEX or any nursing competitive exam, you are in the right place. Here, we upload 2 to 3 advanced nursing videos every single day, filled with clinical reasoning, evidence-based rationales, and stand-coast pearls that make learning not just easier, but unforgettable. In today's high-yield session, we are diving deep into a crucial and often tested topic, nursing care of clients with cancer of the larynx. This condition not only challenges a client's ability to breathe and speak, but also tests a nurse's ability to deliver holistic, compassionate, and skilled care. Throughout this lesson, you will learn about early warning signs such as hoarseness and dysphagia, diagnostic procedures like laryngoscopy and biopsy, and the comprehensive nursing care before and after surgical interventions like laryngectomy. We will also explore airway management, tracheostomy care, communication techniques, and emotional support strategies, all essential for both clinical practice and NCLEX success. So, take a deep breath and stay with us till the end, because this lesson will empower you to understand, care, and advocate like a true professional nurse. And remember, at Stancoast NCLEX, we are not just preparing you to pass, we are preparing you to lead with care. Let's begin today's life-changing session on cancer of the larynx. Hey friend, pause for just a second. I've got something amazing for you. If you want to crush the NCLEX on your very next try, the ultimate NCLEX crash course is exactly what you need. It's helped over 100,000 nursing students pass confidently, and it's packed with everything, from live interactive classes and recorded lessons to 5,000 practice questions, 30 tests, eBooks, and detailed NGN breakdowns. Trust me, this is your all-in-one prep package. Just scan the QR code or hit the link in the description to join instantly and grab your free PDFs, quizzes, and exclusive practice tests. Plus, join our Telegram and WhatsApp channels for even more bonus materials every single week. Let us move into a critical post-operative scenario that demands both vigilance and rapid recognition of early warning signs. After undergoing a total laryngectomy for cancer of the larynx, a client has just returned from the post-anesthesia care unit to the surgical floor. During the initial post-operative assessment, the nurse must stay alert to any subtle changes that may indicate compromised oxygenation. The question asks, which finding, if observed, should immediately raise concern and require prompt intervention? Here are the options to consider. Option A, the client's surgical dressing is moderately blood-stained. Option B, the client suddenly becomes restless and anxious. Option C, the client's heart rate is irregular and variable. And option D, the client reports feeling unusually cold. Correct answer. Option B, the client suddenly becomes restless and anxious. Now, here is the expanded advanced rationale. In the immediate post-operative period following a total laryngectomy, maintaining airway patency and ensuring adequate oxygenation are the nurse's top priorities. Because the upper airway has been surgically removed, the client breathes exclusively through a tracheostomy stoma. Even minor airway obstruction or mucosal edema can quickly lead to hypoxemia. Among all early warning signs, restlessness and anxiety are the most sensitive indicators of developing hypoxia, occurring before any changes in skin color or vital signs become evident. This happens because cerebral neurons are extremely oxygen-dependent, and even a brief reduction in oxygen delivery can manifest as agitation, confusion, or irritability. If left unaddressed, this may progress to rapid breathing, use of accessory muscles, tachycardia, cyanosis, and eventually cardiac dysrhythmias or arrest. Therefore, the nurse must immediately assess airway patency, ensure the tracheostomy tube is clear, suction secretions as needed, provide humidified oxygen, and promptly notify the healthcare provider if obstruction, bleeding, or swelling is suspected. Moving to the other options, option A, a moderately blood-stained surgical dressing, is expected due to the highly vascular nature of head and neck tissues. However, continuous or rapidly increasing bleeding would suggest hemorrhage, which can lead to late-stage hypoxia from blood loss, not an early sign. Option C, an irregular heart rate, may appear later as hypoxia worsens and cardiac oxygen demand increases, but it does not precede behavioral symptoms like restlessness. Option D, the client feeling cold, usually results from anesthesia-related temperature dysregulation or a cool post-operative environment and does not indicate impaired oxygenation. Transitioning now to the Stan-Coast clinical insight, here is something every nurse should remember. After a total laryngectomy, the client has no upper airway connection, so every breath depends entirely on a patent tracheostomy stoma. The first cry for help from a hypoxic brain is not cyanosis. It is restlessness. Recognize that whisper before it becomes silence. And before we wrap up, here is your Stan-Coast high-yield NCLEX pearl to reinforce this concept. Early hypoxia presents as restlessness, anxiety, and tachycardia. Late hypoxia shows cyanosis, irregular pulse, and decreased oxygen saturation. Always assess airway patency and suction secretions first before escalating interventions. Continuous monitoring of oxygen saturation, respiratory pattern, and mental status is crucial for every post-laryngectomy client. Let us now move to a highly practical and emotionally sensitive post-operative scenario. After undergoing a total laryngectomy for cancer of the larynx, a client is in the early post-operative phase and demonstrates difficulty communicating. The question is, which nursing intervention would best facilitate effective communication at this stage? The options provided are: Option A, attempt to lip-read the client's efforts at communication. Option B, instruct the client to speak slowly and clearly. Option C, listen attentively to the client's vocal sounds. And Option D, provide the client with paper and pencil to write messages. The correct answer is Option D, provide the client with paper and pencil to write messages. A total laryngectomy involves the complete surgical removal of the larynx, including the vocal cords. This procedure permanently separates the upper and lower airways, resulting in the total loss of natural voice production. Because air no longer passes through the mouth, nose, or vocal cords, the client cannot generate speech sounds. Therefore, the most therapeutic and immediate nursing action is to establish a reliable alternative communication method. Providing the client with paper and pencil, a whiteboard, or a picture communication board enables expression of basic needs, reduces frustration, and enhances safety and independence. As healing progresses, speech rehabilitation may include esophageal speech, a tracheo-esophageal puncture with a voice prosthesis, or use of an electrolarynx. But these options come later after airway stabilization and tissue healing. Turning to why the other options are not suitable, Option A, attempting to lip-read the client's efforts, is ineffective because after total laryngectomy, there is no ability to articulate or form words. Post-operative swelling, pain, or the presence of the tracheostomy stoma can further limit mouth movements. Additionally, most nurses are not trained in lip reading, which risks misinterpretation and communication breakdown. Option B, instructing the client to speak slowly and clearly, reflects a misunderstanding of the surgery's physiological impact. Since the vocal cords are completely removed, speech is impossible regardless of how slowly or clearly the client tries to talk, making this suggestion both non-therapeutic and emotionally distressing. Option C, listening attentively to the client's vocal sounds, while empathetic, is not effective communication. The noises made post-laryngectomy have no verbal meaning, and relying on them can delay establishment of functional communication, potentially increasing anxiety and isolation. Transitioning to the deeper Stan-Coast clinical insight, before complex rehabilitation techniques begin, something as simple as a pen and notepad becomes the client's lifeline. A nurse who proactively provides these tools does more than restore communication. She restores autonomy, reduces fear, and upholds the client's dignity in one of the most vulnerable moments of recovery. Moving forward to the stand-coast, high-yield NCLEX pearl. In the immediate post-laryngectomy phase, always use written or picture-based communication methods. Avoid false reassurance. Acknowledge the permanence of voice loss honestly but supportively. Initiate early referral to a speech-language pathologist for long-term rehabilitation options. And most importantly, ensure that communication aids remain within the client's easy reach at all times. Let us now explore an emotionally significant scenario involving post-operative psychological adjustment. A client who recently underwent a total laryngectomy for laryngeal cancer is struggling with anger, withdrawal, and sadness related to the loss of speech and changes in appearance. During interdisciplinary team rounds, the nurse carefully observes behaviors that indicate whether the client's grief is beginning to resolve. The question is, which finding best demonstrates that the client is beginning to adapt and accept the change? Here are the options. Option A, the client requests that only the spouse visit. Option B, the client insists the physician made an incorrect diagnosis. Option C, the client observes the tracheostomy tube in a mirror. Option D, the client asks the nurse for help with bathing. The correct answer is option C, the client observes the tracheostomy tube in a mirror. Now, let us understand the expanded rationale behind this choice. Acceptance and adaptation following a body-altering surgery, such as a total laryngectomy, evolve through well-recognized emotional phases of grief: denial, anger, bargaining, depression, and acceptance. Observing the tracheostomy tube in a mirror demonstrates that the client is confronting reality rather than avoiding it. This moment represents the beginning of self-redefinition, showing readiness to integrate the physical change into personal identity. When clients can look at or touch the altered part, it marks the shift from emotional avoidance toward active acceptance. During this stage, nurses should emphasize coping strengths, encourage participation in self-care, and introduce communication aids, such as a whiteboard or electrolarynx, to help rebuild independence and confidence. Moving on to the other options, requesting that only the spouse visit, as in option A, indicates emotional withdrawal and isolation, a behavior typical of the depressive phase of grief, not acceptance. Similarly, insisting that the physician made an incorrect diagnosis, as in option B, is an expression of denial, an early defense mechanism that allows temporary escape from painful truth but prevents progression toward healing. Finally, asking the nurse for help with bathing, seen in option D, reflects dependency and helplessness rather than psychological adjustment. Although seeking assistance is normal, it primarily reflects the depression stage, not yet acceptance or empowerment. Transitioning to the stand-coast, clinical insight. Healing after a laryngectomy is not just physical, it is the rediscovery of voice in silence. When a client faces their reflection and accepts the new image, the true rehabilitation begins. Now moving to the stand-coast high-yield NCLEX pearl. Acceptance is evidenced by acknowledgement of body changes and participation in rehabilitation efforts. Nurses should encourage mirror viewing, involvement in personal care, and the use of alternative communication methods to restore control. Avoid forcing interaction. Instead, provide steady empathy as the client progresses naturally through grief. Collaborating with speech and occupational therapists further supports both emotional recovery and functional adaptation. Here is the end of this session. Thank you for watching. See you in next session.